So we are here today to talk to you about rabies, dismantle some misconceptions, and educate you on what we can do to reduce rabies infection. Let's start out with the basics. Who can get rabies? Well, basically any mammal. That includes people. That's why it's so important for us to be aware of how the infection spreads, symptoms of infection, and what we can do to keep ourselves safe. So let's start with transmission. How does rabies spread?
Rabies? I was in the hospital room with her. How contagious is that? Is that like an STD?
No, you've got to be bitten by something.
This place is so cursed.
Actually, the doctor said it was lucky she came into the hospital because the only way to beat rabies is to start treatment before the symptoms set in. Lockjaw.
Yeah, so definitely not an STD. Rabies is a deadly virus that infects the central nervous system. But yes, rabies can be transmitted through animal bites. Really, any contact with a potentially infected host in which the skin is broken is enough for you to be concerned about rabies infection. What are some examples in which we might be concerned about rabies infection?
It was when you were bitten by a bat a few months ago?
Yes. Dwight here trapped it in a bag against my head.
Just doing my job.
It also says you were recently bitten by a raccoon?
And a rat. Separate occasions.
Right. So usually it doesn't take multiple exposures like that. Really, it shouldn't take multiple exposures where you get bitten to feel like you might have rabies. When it comes to rabies, you should really be worried if the animal that has bitten or scratched you is unvaccinated. Examples of unvaccinated hosts would be stray cats and dogs, wild raccoons, foxes, or bats. So what happens when we let a true exposure go untreated? Well, basically this. It is extremely important that after potential exposure, treatment is sought out right away. When the infection is not identified until later stages, isolation and sedation are usually recommended because it's expected that the individual will not survive. Before, death, untreated patients will suffer through one of two forms of rabies, both of which have different symptoms.
Water bag?
No water for me. Not while rabies causes fear of water. Solidarity!
Michael, that's irrational!
Rabies victims have to live with an irrational hatred of water their entire lives. So, least I can do. Oh, God.
Well, yes. The most common form of rabies in humans is furious. This form manifests with hydrophobia, aerophobia, delirium, hyperactivity, seizures, and agitation. Once these symptoms are present, there is basically no way to help the inflicted individual. When it comes to infection in animals, death is also expected after infection. Unlike popular lore, not all rabid animals are aggressive. In the early stages of disease, behavior changes like aggression and self-isolation are common. In later stages, animals may hypersalivate, have seizures, or become paralyzed. So what can we do to keep ourselves safe from infection? Well, first and foremost, we should all work to avoid potential hosts. Avoid wildlife known to carry the disease, especially in cases in which the potential host is acting strangely. If you see a raccoon, skunk, bat, or other animal that is typically nocturnal out during the day, there's a pretty good chance that something could be wrong. If you notice an animal that looks sick or injured, even though it may not be a result from a rabid animal bite, you should be careful. Your safest bet would be to call animal control. Vaccinate your pets. Up-to-date rabies vaccinations are definitely a key component when it comes to both pet and human protection. Keeping our pets vaccinated prevents them from getting sick, which in turn keeps us safe too. Please don't forget about your cats. Cats need rabies vaccinations just as much as dogs. Although cases of rabies transmission as a result of infected cats are more rare, they are still carriers. Make sure you're following the recommended guidelines for pet vaccinations. When it comes to safety around bats, one of the major steps we can take to protect ourselves is building remediation and bat safety precautions around the home. Discourage bat nesting around homes by blocking entryways, such as chimneys. Do your best to maintain doors and windows closed and in good condition. Bat bites and scratches are different than infection by other hosts. Because bites and scratches can be extremely small, they may go unnoticed. It is really important that you report any physical contact that you make with a bat. Here's all the places you can go to help prevent the spread of rabies and protect yourself.